Hello and welcome to Malachi's Message, Toxic Mold Sucks expert episodes, co-hosted by the co-founders of Malachi's Message, Elizabeth Kripe and Emily Rochelle. Here they will use the platform to interview those who are experts in the industry, hoping to give you the tools and resources that you need to be successful in your healing process. Hi, my name is Elizabeth Kripe, and I'm the Executive Director and co-founder of Malachi's Message. Today, co-hosting is Emily Rochelle. She is Malachi's Message Board Chair and co-founder. We have the unique privilege today in our Toxic Mold Sucks expert series to be hearing from Teresa Scott, a biological dentist that is already, just in our conversation before this recording, given us so much information that both Emily and I did not know going into this. So Teresa, we are so excited. Thank you so much for coming on and just sharing your wisdom and expertise with people.
Oh, well, thank you for inviting me. I feel like you know way more than I do.
No, I have to say though, this topic of dentistry and a link between toxic mold and our mouths is something that both Emily and I know firsthand. I know Josh, Emily, went through his own journey with it, and my youngest daughter, who is now almost 8, went through it right after we came out of mold. So for us, getting answers was very, very hard, and finding a dentist or a biological dentist that would hear us out even or care about what we were trying to bring to them was a battle. So to have somebody like you trying to find the answers and trying to give the information is so critical. And we're just incredibly grateful that you exist and that you're doing what you do.
Well, thank you. I did do a little bit of research just on PubMed and all that stuff, and I'm happy to talk about that, etc. But there's precious little on oral health and mold in terms of like toxic mold. There's not very much out there. But when I started putting together, I guess started joining the dots, I was like, oh, well, that makes sense. Oh, well, that makes sense. Okay, well, that makes sense. But in terms of having literature to back it up, there's not very much out there. So you want me to just start my little presentation, and then after that, you can ask me all the questions you want?
Yes, ma'am, that would be perfect.
All righty. All right, so I am Teresa Scott. I've got a whole alphabet soup of letters behind my name. Basically, I graduated from UT Health Science Center in San Antonio Dental School in 1995. I worked in a public health clinic for the first 6 months after dental practice because they promised me they were going to pay for my school loans, and they lied. So then I worked for another 18 months for a private practice dentist in Stafford, Texas, and then realized that he had said he was interested in selling me his practice, but he really wasn't. So then I started my own private practice in August of 97. So I think we now are 21 years this month, in spring. I have moved once. I used to be on Cypress Wood, and that thing flooded several times, if you've heard any of the horror stories from all the hurricanes. So I'm very lucky that I moved 9 years ago into the practice that I'm on now, which is on 2920. We've never flooded there. Yay. From the start, I was a conventional dentist. I've been a conventional dentist for the longest time. And then my health started failing me. But really what started my journey into all of this was the fact that my youngest daughter was, when she was born, she was allergic to every single commercial formula out there. And the doctors wanted to put her on the broken down protein formula and have her take reflux medicine. And there was something inside of me that said, I will not start my newborn on the hamster wheel that pharmaceuticals is. And so I started looking for other solutions, and I found the Weston Price Foundation. Turns out Weston Price was a dentist, the father of biological dentistry. And so I just did a whole lot of reading, and we found our raw milk group that we joined, and we got raw milk to make her baby formula from. And she was 2 months premature when she was born, and I was unable to breastfeed, because obviously breast is best, but I was unable to breastfeed. And honestly, in hindsight, that's not a bad thing, because I was also extremely mercury toxic. So anyway, she was born in 2009, and I started researching all of these holistic things. I think that's what happens with many moms. I think that they may not take care of themselves very well, but when their babies are born, hell hath no fury. And so we become mama bears. And so that's what happened, is I became a mama bear. And my oldest, I was a little more relaxed, but when Promise was born, her name is Promise. When Promise was born and she was premature and she started having reactions to vaccines and so on and so forth, just everything in me just went, you will not harm my child, because she's a miracle, right? So anyway, 3 years of doing that, and just more and more research that I did. And the more research I did, the more I realized that conventional medicine had failed me. And so I started looking into alternative solutions. And eventually I got to the point where I realized that conventional dentistry was actually not just harmful to me in terms of the mercury, et cetera, but it was harmful to my patients, because they were breathing it too. And so I had to figure out a way to marry what I did with what I believed. And so I became a biological dentist in 2012. And of course, we're all on a journey. So it's not like I just went, flick, okay, I'm biological. No, that's just when I committed to it. And every year I took on something. So I took on perio, so gum disease, right? All the nasty bugs that live in the gums and so on and so forth for people who have gum disease. And then I took on mercury, and then it was ozone, and then it was PRF, and then it was airway. So every year it's been something new. This year is lasers. In dentistry. So every year I take on some new facet that I didn't know before, or I try to deepen my knowledge in something that's just too big for me to learn in 1 year, that kind of thing. So last year, right before COVID, I became the president of the International Academy of Biological Dentistry and Medicine. So that happened. That was a surprise. I had 12 hours notice. Hey, guess what? You're going to be president. Wait, what? Yeah, the former president stepped down. He was ready to retire, and he's like, I think that it's important to go ahead and step down. I'm like, but okay. And so that's what we've been doing. And so the IABDM for the longest time was trying to compete with the AIAOMT in terms of they both are biological dentistry organizations. IAOMT stands for International Academy of Oral Medicine and Toxicology. IABDM, International Academy of Biological Dentistry and Medicine, but they both really are organizations geared towards biological dentistry. And the IAOMT absolutely excels at teaching people why they should become biological, but they only have 2 meetings a year. There's no hands-on training, and it makes it really difficult, because dentistry is a very hands-on profession. We got to use our hands. It's who we are, and so when I became president of the IABDM, I said, there's plenty of people telling people why to do this, but I don't see a whole lot of people showing people how to do this. So that we committed, that was sort of our new mission and passion, was to teach people how to become biological dentists. So that's what we've done this last year and a half, is create classes that people can take that show them step by step how to do this, so that they're not drowning in the why without knowing how to implement it. Because it's all fine and dandy to find out why you have to do something, but then if somebody doesn't show you how to do it, you're just walking around going, okay, well, can you give me any details on that? Like, how is this supposed to look? Because none of us knows, right? So anyway, that's what I did. So that's all about me. Well, that's a very, very short that leaves a whole heck of a lot out, but it's all good. So anyway, when we talked about doing this presentation, one of the, I guess, questions that you sent me was like, what should people know about like mold in the mouth and how it can affect people, etc. And that is a series of multiple dissertations to do that. So I'm a big believer that informed people make better decisions about their health, right? And so some of the books that deal with that sort of oral systemic link are books like Beat the Heart Attack Gene by Brad Bale and Amy Doneen. They are not opposed to pharmaceuticals, but they'll 100% tell you that if you don't follow the nutrition and lifestyle recommendations, that you're shooting yourself in the foot. You're setting yourself up for a heart attack or a stroke. Well, one of the things they discuss in that book is the relationship between endodontic disease and periodontal disease. For example, they found a study that showed that 78% of the blood clots from strokes and embolisms have the bacteria in them from dead teeth. Yikes, right? They also found that 50% of all heart attacks are directly caused by oral infections like gum disease. So all of those people who have pockets and they go to the dentist, they have their pockets measured and the dentist recommends a deep cleaning. There's a reason for it, but not a whole lot of people bother to tell their patients, like, this is the research behind it. And so of course people take it lightly because gum disease isn't painful until your teeth start hurting and then they fall out. It's a painless disease. It's kind of like diabetes. Diabetes is silent as well. And because it's silent, since it's not painful, you don't really pay attention to it, right? So that's this book is very, very good at showing people, it's like, look, there really is a link between your oral health and your systemic health, and it's important to get it under control. Now, they recently have started doing, have started understanding the link between airway and systemic disease. But when I took the class, they weren't really mentioning it in terms of that, other than to say, okay, obstructive sleep apnea is an issue. Okay, and here's one of the things that, for example, a whole lot of people don't know. The machines that help people breathe in terms of obstructive sleep apnea, right? They're called CPAPs, continuous positive air pressure machines. Those things get full of mold. I mean, full of mold, because it's warm, moist air, right? And so it's not something that you want to be dependent on for life. You need to find a different solution. It's a stopgap measure. It's better than not being able to breathe at all, but you really don't want to be dependent on one of those machines forever. That's the Band-Aid that helps you get through until you can actually fix the problem. Okay. All right. The End of Alzheimer's. Another thing, that one was by Dale Bredesen. Really, really cool thing. He talks about toxicity. And one of the things he talks about is mercury, but another thing he talks about is things like mold, so, and how toxins can alter mind, and in his case can cause symptoms of cognitive decline, etc. Then the other books are more, I guess, esoteric. They're a little harder to read. GAPS, I don't know if you've ever heard of the GAPS diet, but it stands for gut and psychology syndrome. And it turns out that our gut flora, our microbiome in our gut, affects our mental health. Like there's a true connection there. And one of the things that can interrupt our gut health, obviously, is mold, right? So you have a whole lot of people running around with altered mental statuses, and really there's every possibility that something in their gut is out of balance because of the mold which then causes them to have anxiety, depression, etc. So it's a quite a big hamster wheel, in terms of what causes what. Same thing with PANS and PANDAS, and just like I said, there's like 8 books there, and they're all really, really good at explaining toxicity and environmental illnesses, and the link between oral and systemic health is mentioned in all of them at least a little bit. It's not perfect, but there's definitely lots to read there. So I encourage everybody to, again, do their own research, because at the end of the day, informed people make better decisions. So I did go on to PubMed and found cases of like toxic mold causing issues, and it's a lot of science, but the biggest thing that I found in terms of oral health, caused by some kind of fungal infection is Candida. Candida is a yeast, and it's considered to be normal flora, but it can rapidly become pathogenic. In other words, every time that a person takes an antibiotic, it'll kill the bacteria, but it doesn't kill the yeast. And so then they take the antibiotic, the yeast go up, throws the flora off, people get yeast infections, and they can be localized yeast infections, or they can become things like thrush. They can become much more systemic. Mercury toxicity causes yeasts to go completely out of balance. And so in my case, what happened in terms of that was that I had severe systemic yeast infection that caused me to not be able to sleep. I had severe insomnia. I wasn't sleeping more than 2.5 hours a night for about 12 years, right? So you can imagine how psychotic I may have become towards the end of it, and made not very smart decisions about anything at that point, because I was just so sick, and it was all yeasts, right? I have no doubt that there was some mold toxicity in there also, just because my old office was also infested with mold, but that was 9 years ago. So, and you can see Candida here, it's linked to oral cancer. Here it's talking about how Candida contributes to inflammation. This one shows that Candida can switch from the benign unicellular yeast thing to the filamentous form, and the filamentous form is what activates the inflammation pathway. This one showed that Candida managed to escape. This shows how it manages to escape detection by the immune system. So that's how Candida thrives, right? Well, there's a theory that's going around that says that cancer is actually a fungal infection, right? And that actually makes quite a bit of sense to me, because they act the same way in the fact that they can hide from the immune system, so there's probably a link in there somewhere. This one showed that there's a direct correlation between Candida and oral cancer, like literally. The higher the Candida levels, the likelier the contribution to developing the oral cancer. This one showed that there was a direct relationship between the level of Candida and the presence of oral cancer, so similar to the other study. And this one showed that chronic oral candidiasis, I gotta spell that right. Candidiasis may be an indicator or of local or systemic disorder of the cellular immune system. So basically it can be sort of your little red flag, oh crap, something's going on, and it's actually disrupting, it's something much bigger. Does that make sense? So then how does mold impact a person's dental health? And I think I talked about it shortly before we started talking. And basically all of these things cause a person, the sinuses are basically warm, moist environments, and they're warm, moist caves that have very, very poor drainage. Okay, they don't drain well. So what grows best in very poor drainage, warm, moist space? Mold, right? So how does that, what happens when you have mold up there? And I talked to an ENT years ago. My husband had sinus surgery, and the guy kept giving him antibiotic after antibiotic after antibiotic, going, well, why isn't this getting better? And then Dan had his surgery, And it finally occurs to the guy, oh, because what he found in Dan's sinuses was mold. Like literally, he goes, it was the worst fungal infection he had ever seen, and so it took 3 liters of saline to drain all that stuff out, and where do you think that mold came from? His CPAP machine, right? So mouth breathing is not good. That is the introduction to airway issues. The whole thing with mouth breathing is and it comes from more than just the tongue. So for a whole lot of people, it's the fact that they're tongue tied and their tongue can't rest against the roof of the mouth. And so it's not creating that barrier, right? That then causes a person to have to breathe through their nose. Instead, they're keeping their tongue down and back because their nose is all stopped up, their sinuses are all stopped up, they can't breathe, so they breathe through their mouth and then trying to get oxygen, because you don't breathe, you don't live, right? So what happens is, in all of that, is then the person's palate becomes deformed, it reshapes, it becomes a high, narrow, vaulted palate instead of a wide, shallow palate. Well, that makes the sinuses drain even less, and so you've got all these people walking around with chronic congestion and allergies, and then it occurs to them to take antihistamines because they're always dripping and sneezing, etc. Well, what does an antihistamine do? It dries you up. Does it dry you up completely? No. It creates a big, thick, gloopy, gooky, gluey kind of thing inside your sinuses where you can't drain it out. Perfect fodder for growing mold. So let's exacerbate it even more. So antihistamines are not a good thing to take. And I completely understand not wanting to, not wanting to be sneezing or dripping when you've got a social function, etc. But I'm a big fan of eliminating the root cause rather than just the symptoms. So if you take an antihistamine, you're eliminating the symptoms, but it's not actually fixing the root cause of the problem. Which is obviously the congestion in the sinuses, which is usually fungal in nature. Okay, so all those antibiotics that people get for sinus infections, really they're fungal infections. Most of them are fungal infections. So anyway, the biggest culprit, like I said, it's Candida. And it will, but these are pictures that I'm going to show you. Like this was just an impression that we took on a patient's mouth. We put it in a plastic bag. It's not like it was exposed to our office at all. We immediately put them in a plastic bag and forgot about them. And several weeks later, we found this. And I was like, oh, but it was in a plastic bag. It's not like it was exposed to the air in our office. So that warm, moist environment up in a cabinet, something grew in there. Okay. And then this one's going to really gross you out, y'all. This is a denture that somebody wore for like 30 years. And they never changed it out. And the only reason that they came in was, if you'll notice right here, there's a hole that's worn through into the denture, because otherwise they'd have just kept wearing it. So anyway, that is, I guess that's the short and the long of it. So what do we do? How do we combat this? Well, nutrition matters. I always talk to my patients about eating organic whole foods to eliminate white foods, rice, bread, pasta, potatoes, simple sugars, yeasts, simple sugars and starches, even the more complex ones. If you're fighting mold or yeast, they feed on that stuff. So one of the things that I did in going through my own journey fighting the yeasts in my own body, etc., was I had to go on a ketogenic diet for a good while. And I also had to give up things like mushrooms and fermented foods, etc., because even if they had good yeasts, it still was, we needed to get rid of completely all of it and then reseed the microbiome properly. The Gut and Psychology Syndrome book talks about the benefits of grass-fed meat and bone broth, etc., because it's just very healing to the gut. Because what happens with mold and heavy metals and other toxins, it causes leaky gut. You know, and so we're trying to heal the gut with the collagen from the bone broths and the minerals from the bone broths, etc. You do want to increase the fiber in your diet and other prebiotic foods. Things like onions are phenomenal prebiotic foods. Garlic, same thing. You know, but lots and lots of fiber. Why? Because fiber is actually what good bacteria grow on, you know. So you want to have a higher fiber diet, lots of veggies, lots of green leafies, that kind of thing. And I always recommend for my patients to have something. Now, if you're on a yeast cleanse, you can't do the probiotic part of it until after you're done. But with every meal, all of us as human beings should have something crunchy, something chewy, and something probiotic, right? So every meal should include at least 1 to 2 tablespoons per person of something very crunchy, like almonds is a good one. Something very chewy, like beef jerky or dried fruits. Those are very chewy. And something probiotic, kefir, kombucha, kvass, yogurt, pickles, old-fashioned pickles, not the vinegar ones. You know, something probiotic. Sauerkraut is another really good one. Those are all good gut healing things that you need anyway in order to you know, start your gut journey, your gut healing journey when you're dealing with mold. And then environment matters. And I just put discussion with Elizabeth. You got to get out of the moldy environment. If you don't, then, you know, you're kind of sort of 2 steps forward, 1 step back kind of thing. You'll make differences, but if you don't get yourself out of your moldy environment, then, you know, it's going to continue to affect you. And I said, learn from the Moms Against Mold group. You know, y'all know more, way more than I do. Try to create a mold-proof environment where you live. And then there's what about your workspace? You know, because think about it. Everybody that I know of that's like understanding mold, etc., are trying to fix their homes, you know, but what about their work environment? If their work environment is full of mold too, you know, you're back again to the, all right, well, you're just getting environmental exposure all over the place. So it's helpful if those that someone is working with are also aware in terms of mold, etc. And then my last slide just says co-infections and comorbidities matter. So it's important to go see your dentist, right? Your oral hygiene really does matter because of that, you know, the books that are listed in like the second slide. It really does matter to get those things under control. Your gum disease, infected root canals, you know, all of those things. And then airway, got to get you back to nose breathing. If you're mouth breathing all the time, then you're going to continue to have a microbiome that is unhealthy and unwelcoming to good bacteria. And it's just going to feed bad bacteria. And then obviously metabolic health is important. So people who are diabetic, for example, are going to be at higher risk for having mold type illnesses or yeast type illnesses. Why? Because their body is just basically one big giant sugar factory, and the molds and the yeasts feed on that. So they're like, woo, yay. Proper supplementation, always work with a functional medicine doctor. It's important. A good functional medicine doctor, it's really important to not do these things by yourself. A lot of people try to detox from stuff themselves, and I promise you, I've learned the hard way. As educated as I am, I needed somebody to work with me, you know, and figure out what I was missing. Because if you're working on yourself, then there's a big blind spot. But if somebody else is looking at you, then they can see the entire you and the entire issue. So that's my presentation. Ask me all the questions you want.
I just appreciated so much that you chose to do this in a very holistic picture and not just focus specifically on the few things that some dentists are probably seeing after people have gone through a toxic mold experience, because everything you've said is exactly. Emily, I need you to take a question real quick. Do you have anything you'd like to ask her?
Everything you just said was just absolutely just such important information that you just gave. And but when it comes to like inflammation of the gums, like, because you know the toxins, how does that affect the inflammation of the gums?
So remember what I talked about in terms of mouth breathing?
Yes.
Right. So everybody who mouth breathes, it makes their bacteria in their mouth go wonky. So
Okay.
it when you mouth breathe, your tissues don't the bacterial levels change, they alter. And so things will grow in there because your saliva can't clear it because your mouth gets dry. So it can't clear the food.
Mhm.
Right. And if it can't clear the food, then yeasts and stuff will start to feed on that, which again, it leans back to that Candida issue. So that's why diets really should be lower in carbs. They don't need to be ketogenic unless you're actually doing a yeast cleanse. But, you know, the diets that are super high in processed sugars, man, that's just feeding mold and Candida. Does that make sense? So the
That makes
bacteria,
sense.
yeah, and then the bacteria in the mouth, all of those things, they like to live in the yeasts and molds like to live in warm, moist environments that are not easy to clean. So underneath the gums and between the teeth, very difficult to get there to clean. So of course that is where you're going to get an awful lot of buildup of things because it's all sitting down in there. It's why it's important to have regular cleanings often. And I'm a big advocate of ozone in the sinuses and ears because ozone is lovely. It kills everything. It kills bacteria, it kills fungus, it kills viruses, and it also kills even prions, which are those little bitty ends and pieces of genetic material that cause mad cow disease. So, you know, it's pretty powerful and it's just oxygen, right? So I'm a big believer in ozone insufflation when a person has sinus infection. Better than taking medication is actually put something up there that's going to kill the nasties. So
I apologize for stepping away for a second. My neighbor came to the door unexpectedly,
no
but I'm
worries.
going to say I can relate, and hearing the timeline of everything you said made so much sense to me, because when we were in our toxic environment, I ended up with many respiratory infections, which then did cause me to have to go in and have sinus surgery. The same, very similar to your husband, where they came out after and said this was a fungal infection. Like this,
Yeah, but they kept giving you antibiotics first, didn't they?
Oh, I went through legitimately in the 6 months we were in our toxic environment, probably five
rounds.
rounds.
At least. Yeah. My husband went through 3 years of that before finally. And the problem is every time you take antibiotics, right? Yes, it'll knock down the bacteria, but it won't completely knock them away. So then my mom has multiple drug resistant bacteria from 50 years of taking antibiotics at least 3 to 7 times a year. Like she's been on them for that long, right? And her doctors just kept prescribing them for urinary tract infections. And so now every time she goes to the hospital, they put her in isolation wards because she's got multiple drug resistant bacteria. And then after that, they send her home to die. Twice they've done this, you know, and then I have to take over and heal her with ozone oil and silver, you know, which are that also takes care of anything moldy, you know. So it's just like, I wish that they would understand that antibiotics are something that a person should take only if the more alternative things hasn't worked, you know, because man, I prescribe antibiotics every time I do extractions and stuff, but for people actually having to take them, it's not often that they actually have to take them. You know, maybe once a year, you know. Maybe once a year I'll have a patient who has to take the antibiotics, you know. So it doesn't have to be that way, but unfortunately, conventional medicine approach, and that's why I prescribe the antibiotics, because God forbid I don't prescribe them, then I might get in trouble with my license. But do I like antibiotics? No. Do I understand the damage that they cause? Yes. It was because of my sinus infections that my gut went out of control, you know?
Which is exactly, yes, the same thing. By the time I found an allergist immunologist that I call her my unicorn doctor because she is just amazing. But the same thing, we went back to, well, I had an overload of Candida. We had to clean my gut first. We had to start there and take care of the leaky gut. And then we were able to slowly reseed and start building a healthy system again. So as you were talking, just the timeline of what you were saying and the correlation between how the respiratory starts so many of the issues that end up in your mouth, and how your nutrition and your gut and everything, it does work together.
Exactly.
So just going to the dentist.
They're not mutually exclusive. They actually
Yes.
are a very finely tuned, intricately working, intimately working machine, very finely tuned.
I love that you put it together though, for people to hear. That's huge. So they don't just think, oh, I have a root canal just because I have a root canal, but there's a bigger picture here. There are other things, like you said, you can't just put a Band-Aid over it. You need to figure out the root cause.
Correct.
Yeah.
So,
Man, I thank you so much for that.
you're welcome. Well, I mean, one of the things that a lot of my patients end up with, right? They're clenching their teeth. Well, when you don't have an airway, you clench your teeth because you're trying to stick try to imagine your tongue as a 6-foot tiger and your teeth are the cage, right? If your 6-foot tiger only has a 3-foot cage to try to stick into, because that mold, etc., has made a long, high vaulted, narrow palate, right? Your tongue can't reach up properly, so it's trying to stick itself into a cage that's too tall and too skinny for it to get into, right? Where do you think that tiger's butt is sitting? Back of the throat, right? So you've got all these people who are clenching, grinding, gritting, snoring, have sleep apnea, right?
Yeah.
They're killing their teeth. So their teeth are dying and they end up with a bunch of root canals over clenching their teeth and cracking their teeth from clenching so hard just because they're trying to breathe.
That was a huge symptom of our family. Was first off, snoring just started out of nowhere. You know, my son Sebastian could be heard down the hallway. He snores so loud, but the teeth grinding, both me, my husband, and Sebastian all had terrible teeth grinding issues. And Josh unfortunately had a root canal, you know, in the past, which made us not kind of put together where he was still having like an infection. That was still causing him to have symptoms. And so I always tell everybody I meet, if they are still having symptoms after they get out of mold, they need to go have their teeth looked at, because that could be an area.
Correct, but it needs to be by a biological dentist.
Yes.
That's going to look for root cause. And unfortunately, I mean, I wish I could say otherwise, but conventional dentists just don't, we're not taught that in dental school. In all fairness, it's not their fault. They don't teach us that.
Yeah.
No. So how are you going to know if you don't know? You don't know what you don't know.
Yeah.
You know?
I would say we ran into that with my daughter. The first conventional dentist we went to had no clue. The second one is, again, just a very rare breed because she's conventional dentist. But the first thing she told us was, what environment are you in? And she started having a conversation with me about Jordan's diet too. And so I looked at that and went, and I told her, I said, you're rare. I said, from the people I know, unless you are a biological dentist, you aren't going to have this conversation with me. And she said, well, my goal is to find out what's causing this for your daughter. And she is actually in California. And we still, to this day, we no longer live in California, but every 6 months, both my daughters, we make sure we take a trip back to her because she understands exactly what you're talking about. And people have looked at us like we're crazy. And they're like, why would you do that? And I'm like, because she actually knows. I want to make sure I take my daughters to somebody that is actually looking at their whole body and not just the one tooth that most other conventional dentists would look at.
Yeah.
But we got very, very lucky.
Good. I'm very glad for you.
Yeah. Emily, do you have anything else you'd like to ask before we sign off?
Other than Josh and I got super lucky whenever we found Teresa to be our biological dentist, because she helped get to the root cause of Josh's remaining symptoms. And I learned so much. I had no idea there was a biological dentist. I didn't know what it was until I was introduced to Teresa. So
Well,
she's
thank
amazing at what she does.
Well, thank you very much. It's
Thank
all-
you for taking such great care of us.
Oh, always. Honestly, if I didn't have my own journey to go down, then none of this would have happened. Like, it all started, every dentist that becomes biological gets there because they got sick. It's really, really rare to find a biological dentist that went into it from the start. Generally we got sick, really, really sick, deathly ill. And that's what leads us down this path. So I'm no different there. I got sick. So I'm glad that I'm able to help other people now, but it all started with me finding, me getting very sick. So, and finding the answers for my family and finding the answers for me. And then it just, I was like, all right, well, obviously I'm gonna have to do this for other people too. So there you go.
Awesome. Well, thank you so much for taking time out of your day to meet with us and just, man, give us all of this amazing information. We're incredibly
Always
grateful.
happy to do that. Thank you so much for having me. It was an honor.